Let's talk about test-taking strategies. Key test-taking strategies. Focus on the data. Visualize the event. Look for strategic words. Determine if question is positive or negative query. Avoid asking yourself, well, what if? Use elimination, comparable, or alike options. Umbrella or encompassing option. Closed-ended words. Use ABCs, Maslow's hierarchy of needs, nursing process, therapeutic communication techniques, delegating and assignment making guidelines, pharmacologic guidelines. Sample question. Avoiding the what if and reading into the question. The nurse is caring for a hospitalized client with a diagnosis of heart failure who suddenly complains of shortness of breath and dyspnea during activity. After assisting the client to bed and placing in high Fowler's position, the nurse should take which immediate action? 1. Administer high flow oxygen to the client. 2. Call the cardiologist to report the findings. 3. Prepare to administer an additional dose of furosemide. 4. Obtain a set of vital signs and perform focused respiratory and cardiovascular assessments. You may immediately think that the client has developed pulmonary edema, a complication of heart failure, and needs additional diuresis. In pulmonary edema, one may see this as an emergency and might think an action should be taken before further assessment, which may lead you to choose option 3. Although pulmonary edema is a complication of heart failure, the question does not specifically state that pulmonary edema has developed. The client could be experiencing shortness of breath or dyspnea as a symptom of heart failure exacerbation, which may be expected, particularly on exertion or during activity. This is why it is important to base your answer only on the information presented without assuming something else could be occurring. Read the question carefully. Note the strategic word immediate. And focus on the data in the question, the client's complaints. Use the nursing process and note that vital signs and assessment data would be needed before administering oxygen, administering medications, or contacting the cardiologist. Although the cardiologist may need to be notified, this is not the immediate action because there are no data in the question that indicate the presence of pulmonary edema. That is why the correct answer is number 4. Additionally, focus on what the question is asking. The question is asking you for a nursing action, so that is why you need to look for as you eliminate the incorrect options. Use nursing knowledge and test-taking strategies to assist in answering the question. Remember to focus on the data in the question. Focus on what the question is asking and avoid the what if syndrome and reading into the question. Next is ingredients of a question: event, event query, and options. Event: the nurse is caring for a client with terminal cancer. Event query: the nurse should consider which factor when planning pain relief. Options: 1. Not all pain is real. 2. Opioid analgesics are highly addictive. 3. Opioid analgesics can cause tachycardia. 4. Around-the-clock dosing gives better pain relief than as-needed dosing. Focus on what the question is asking. The factor to consider when planning pain relief and consider the client's diagnosis of terminal cancer. Around-the-clock dosing provides increased pain relief and decreases stressors associated with pain, such as anxiety and fear. Pain is what the client describes as it is. and any indication of pain should be perceived as real for the client. Opioid analgesics may be addictive, but this is not a concern for a client with terminal cancer. Not all opioid analgesics cause tachycardia. Remember to focus on what the question is asking. So the answer is number 4. Common strategic words that indicate the need to prioritize and reflect assessment. Words that indicate the need to prioritize are best, early or late, essential, first, highest priority, immediate, initial, most appropriate, most important, most likely, next, primary, vital. Words that reflect assessment: ascertain, assess, check, collect, determine, find out, gather, identify, monitor, observe, obtain information, recognize. Sample questions, strategic words. The nurse is caring for a client who just returned from the recovery room after undergoing abdominal surgery. The nurse should monitor for which early sign of hypovolemic shock. 1. Sleepiness. 2. Increased pulse rate. 3. Increased depth of respiration. 4. Increased orientation to surroundings. Note the strategic word early in the query and the word just in the event. Think about the pathophysiology that occurs in hypovolemic shock to direct you to the correct option. Restlessness is one of the earliest signs, followed by cardiovascular changes, increased heart rate, and a decrease in blood pressure. Sleepiness is expected in a client who has just returned from surgery. Although increased depth of respirations occur in hypovolemic shock, it is not an early sign. Rather, it occurs as the shock progresses. This is why it is important to recognize the strategic word early when you read the question. It requires the ability to discern between early and late signs of impending shock. Increased orientation to surroundings is expected and will occur as the effects of anesthesia resolve. Remember to look for strategic words in both the event and the query of the question. Subject of the question. The nurse is teaching a client in skeletal leg traction about measures to increase bed mobility. Which item would be most helpful for this client? 1. Television. 2. Fracture bedpan. 3. Overhead trapeze. 4. Reading materials. Focus on the subject, increasing bed mobility. Also note the strategic word most. The use of an overhead trapeze is extremely helpful in assisting a client to move about in bed and to get on and off the bedpan. Television and reading materials are helpful in reducing boredom and providing distraction, and a fractured bedpan is useful in reducing discomfort with elimination. These items are helpful for a client interaction, but they are not directly related to the subject of the question. Remember to focus on the subject. So the answer is number 3. Positive event query. The nurse provides medication instructions to a client about digoxin. Which statement by the client indicates an understanding of its adverse effects? 1. Blurred vision is expected. 2. If my pulse rate drops below 60 beats per minute, I should let my cardiologist know. 3. This medication may cause headache and weakness, but that is nothing to worry about. 4. If I am nauseated or vomiting, I should stay on liquids and take some liquid antacids. This question is an example of a positive event query question. Note the words indicates and understanding. And then focus on the subject, adverse effects. Additionally, focus on the data provided in the options. Digoxin is a cardiac glycoside and works by increasing contractility of the heart. This medication has a narrow therapeutic range and is a major concern. And a major concern is toxicity. Currently, it is considered second-line treatment for heart failure because of its narrow therapeutic range and potential for adverse effects. Adverse effects that indicate toxicity include gastrointestinal disturbances, neurological abnormalities, bradycardia or other cardiac irregularities, and ocular disturbances. If any of this occur, the cardiologist is notified. Additionally, the client should notify the cardiologist if the pulse rate drops below 60 beats per minute, because serious dysrhythmias are another potential adverse effect of digoxin therapy. Remember to focus on the data provided and note positive event queries. The answer is number 2. Negative event. The nurse has reinforced discharge instructions to a client who has undergone a right mastectomy with axillary lymph node dissection. Which statement by the client indicates a need for further teaching regarding home care measures? 1. I should use a straight razor to shave under my arms. 2. I need to be sure that I do not have blood pressures or blood drawn from my right arm. 3. I should inform all of my other healthcare providers that I have had this surgical procedure. 4. I need to be sure that I wear thick mitt, hand covers, or use thick pot holders when I am cooking and touching hot pans. This question is an example of a negative event query. Note the strategic words need for further teaching. These strategic words indicate that you need to select an option that identifies an incorrect client statement. Recall that edema and infection are concerns with this client due to the removal of lymph nodes in the surgical area. Lymphadenopathy with associated lymphedema can result, and the client needs to be instructed in the measures that will avoid trauma to the affected arm. Recalling that trauma to the affected arm could potentially result in edema and/or infection will direct you to the correct option, which is number 1. Remember to watch for negative event queries. Use of the ABCs. A client with a diagnosis of cancer is receiving morphine sulfate for pain. The nurse should employ which priority action in the care of the client? 1. Monitor stools. 2. Monitor urine output. 3. Encourage fluid intake. 4. Encourage the client to cough and deep breathe. Recall that morphine sulfate suppresses the cough reflex and the respiratory reflex, and a common adverse effect is respiratory depression. Coughing and deep breathing can assist with ensuring adequate oxygenation, since the number of respirations per minute can potentially be decreased in a client receiving this medication. Although options 1, 2, and 3 are components of the plan of care, the correct option addresses airway and breathing, and that is number 4. Remember to use the ABCs, airway, breathing, circulation, to prioritize. So answer is number 4. Maslow's hierarchy of need theory. The nurse caring for a client experiencing dystocia determines that the priority is which action. 1. Position changes and providing comfort measures. 2. Explanations about what is happening to the client. 3. Monitoring for changes in the condition of the mother and fetus. 4. Reinforcement of breathing techniques learned in childbirth preparatory classes. All the options are correct and would be implemented during the care of this client. Note the strategic word priority and use Maslow's hierarchy of needs theory to prioritize, remembering that physiological needs come first. Also, the correct option is the only one that addresses both the mother and the fetus. Remember to use Maslow's hierarchy of needs theory to prioritize. So here is Maslow's hierarchy of needs. Basic physiological needs: safety and security, love and belonging, self-esteem, and self-actualization. So the answer to this question is number 3. The nursing process. Assessment. A client who had an application of a right arm cast complains of pain at the wrist when the arm is passively moved. What action should the nurse take first? 1. Elevate the arm. 2. Document the findings. 3. Medicate with an additional dose of an opioid. 4. Check for paresthesia and paralysis of the right arm. Note the strategic word first. Based on the data in the question, determine whether an abnormality exists. The question event indicates that the client complains of pain at the wrist when the arm is passively moved. This could indicate an abnormality. Therefore, further assessment or intervention is required. Use the steps of the nursing process, remembering that assessment is the first step. The only option that addresses assessment is the correct option, which is number 4. Options 1, 2, and 3 address the implementation step of the nursing process. Also, these options are incorrect first actions. The arm in a cast should have already been elevated. The client may be experiencing compartment syndrome, a complication following trauma to the extremities and application of a cast. Additional data need to be collected to determine whether this complication is present. Remember that assessment is the first step in the nursing process. So the correct answer is number 4. Nursing process analysis. The nurse reviews the arterial blood gas results of a client and notes the following: pH of 7.45, PCO2 30, bicarbonate 22. The nurse analyzes these results as indicating which condition. 1. Metabolic acidosis compensated. 2. Respiratory alkalosis compensated. 3. Metabolic alkalosis uncompensated. 4. Respiratory acidosis uncompensated. So let's look at the normal ABGs. In our question, pH is 7.45. Normal pH, 7.35 to 7.45. So by looking at the pH, it's more on the alkalotic side. Next is carbon dioxide, which is 30. Normal carbon dioxide, 35 to 45. Lower than 35 means respiratory alkalosis. So pH alkalosis, carbon dioxide alkalosis. Now let's go to bicarbonate, 22, which is normal. So now our answer is number 2, respiratory alkalosis compensated. It's compensated because the pH, though higher, but it is still within the normal range. That is why compensated respiratory alkalosis. So we will talk about arterial blood gases in details in the next or in future videos. It's beyond the scope of this video to discuss about ABGs because we are talking about test-taking strategies. Next is planning. The nurse developing a plan of care for a client with a cataract understands that which problem is the priority. 1. Concern about the loss of eyesight. 2. Altered vision due to opacity of the ocular lens. 3. Difficulty moving around because of the need for glasses. 4. Becoming lonely because of decreased community immersion. Note the strategic word priority and use the steps of the nursing process. This question relates to planning nursing care and asks you to identify the priority problem. Use Maslow's hierarchy of needs theory to answer the question, remembering that physiological needs are the priority. Concern and becoming lonely are psychosocial needs and would be the last priorities. Note that the correct option directly addresses the client's problem. Remember that planning is the third step of the nursing process. So our answer is number 2. Nursing process implementation. The nurse is caring for a hospitalized client with angina pectoris who begins to experience chest pain. The nurse administers a nitroglycerin tablet sublingually as prescribed, but the pain is unrelieved. The nurse should take which action next? 1. Reposition the client. 2. Call the client's family. 3. Contact the healthcare provider. 4. Administer another nitroglycerin tablet. Note the strategic word next and use the steps of the nursing process. Implementation questions address the process of organizing and managing care. This question also requires that you prioritize nursing actions. Additionally, focus on the data in the question to assist in avoiding reading into the question. You may think it is necessary to check the blood pressure and before administering another tablet, which is correct. However, there are no data in the question indicating that the blood pressure is abnormal and could not sustain if another tablet were given. In addition, checking the blood pressure is not one of the options. Recalling that the nurse would administer 3 nitroglycerin tablets 5 minutes apart from each other to relieve chest pain in a hospitalized client will assist in directing you to the correct option, which is number 4. Remember that implementation is the 4th step of the nursing process. Answer is number 4. The nursing process evaluation. The nurse is evaluating the client's response to treatment of a pleural effusion with a chest tube. The nurse notes a respiratory rate of 20 breaths per minute, fluctuation of the water level in the water-sealed chamber, and a decrease in the amount of drainage by 30 ml since the previous shift. Based on this information, which interpretation should the nurse make? 1. The client is responding well to treatment. 2. Suction should be decreased to the system. 3. The system should be assessed for an air leak. 4. Water should be added to the water-sealed chamber. Use the steps of the nursing process and note that the nurse needs to evaluate the client's response to the treatment. Focus on the subject and the data in the question. Also, determine whether an abnormality exists based on this data. Remember that fluctuation in the water-sealed chamber is a normal and expected finding with a chest tube. Because the client is being treated for a pleural effusion, it can be determined that he or she is responding well to treatment if the amount of drainage is gradually decreasing because the fluid from the pleural effusion is being effectively removed. If the drainage were to stop suddenly, the chest tube should be assessed for a kink or blockage. There is no indication based on the data in the question to decrease suction to the system. In fact, it is unclear as to whether the client is on suction at all. There are also no data in the question indicating an air leak. Lastly, there are no data in the question indicating the need to add water to the water-sealed chamber. Again, it is unclear as to whether the client has this type of chest tube versus a dry suction chest tube. Remember that evaluation is the 5th step on the nursing process. So the answer to this question is number 1. The client is responding well to treatment. Determine whether an abnormality exists. The nurse is caring for a client being admitted to the emergency department with a chief complaint of anorexia, nausea, and vomiting. The nurse asks the client about the home medication being taken. The nurse would be most concerned if the client stated that which medication was being taken at home. 1. Digoxin. 2. Captopril. 3. Losartan. 4. Furosemide. Note the strategic word most. The first step in approaching the answer to this question is to determine whether an abnormality exists. The client is complaining of anorexia, nausea, and vomiting. Therefore, an abnormality does exist. This tells you that this could be an adverse or toxic effect of one of the medications listed. Although gastrointestinal distress can occur as an expected side effect of many medications, anorexia, nausea, and vomiting are hallmark signs of digoxin toxicity. Therefore, the nurse should be most concerned with this medication if taken at home by the client. Remember to first determine whether an abnormality exists in the event before choosing the correct option. The answer is number 1, digoxin. Communication. A client scheduled for surgery states to the nurse, "I'm not sure if I should have this surgery." Which response by the nurse is appropriate? 1. It's your decision. 2. Don't worry, everything will be fine. 3. Why don't you want to have this surgery? 4. Tell me what concerns you about this surgery. Use therapeutic communication techniques to answer communication questions and remember to focus on the client's thoughts, feelings, concerns, anxieties, and fears. The correct option is the only one that addresses the client's concern. Additionally, asking the client about what specific concerns he or she has about the surgery will allow for further decisions in the treatment process to be made. Option 1 is a blunt response and does not address the client's concern. Option 2 provides false reassurance. Option 3 can make the client feel defensive and uses the non-therapeutic communication technique of asking why. Remember to use therapeutic communication techniques and focus on the client. The answer is number 4. Tell me what concerns you about this surgery. Eliminate comparable or alike options. The nurse is caring for a group of clients. On review of the client's medical records, the nurse determines that which client is at risk for excess fluid volume. 1. The client taking diuretics. 2. The client with an ileostomy. 3. The client with kidney disease. 4. The client undergoing gastrointestinal suctioning. Focus on the subject. The client at risk for excess fluid volume. Think about the pathophysiology associated with each condition identified in the options. The only client who retains fluid is the client with kidney disease, the client taking diuretics, the client with an ileostomy, and the client undergoing gastrointestinal suctioning all lose fluid. These are comparable or alike options. Remember to eliminate comparable or alike options. Eliminate options that contain closed-ended words. A client is to undergo a computed tomography, CT scan of the abdomen with oral contrast, and the nurse provides pre-procedure instructions. The nurse instructs the client to take which action in the pre-procedure period. 1. Avoid eating or drinking for at least 3 hours before the test. 2. Limit self to only 2 cigarettes on the morning of the test. 3. Have a clear liquid breakfast only on the morning of the test. 4. Take all routine medications with a glass of water in the morning of the test. Note the closed-ended words only. In options 2 and 3, and all in option 4. Rather, eliminate options that contain close-ended words because these options are usually incorrect. Also, note that options 2, 3, and 4 are comparable or alike options in that they all involve taking in something on the morning of the test. Remember to eliminate options that contain closed-ended words. So the correct answer is number 1. Avoid eating or drinking for at least 3 hours before the test. Look for the umbrella option. A client admitted to the hospital is diagnosed with a pressure injury in the coccyx with a wound vac. The wound culture results indicate methicillin-resistant Staphylococcus aureus is present. The wound dressing and wound vac foam is due to be changed. The nurse should employ which protective precautions to prevent contraction of the infection during care? 1. Gown and gloves. 2. Gloves and a mask. 3. Contact precautions. 4. Airborne precautions. Focus on the client's diagnosis and recall that this infection is through direct contact. Recall that contact precautions involves the use of gown and gloves for routine care and the use of gown, gloves, and face shield if splashing is anticipated during care. Note that the correct option is the umbrella option. Remember to look for the umbrella option, a broad or universal option that includes the concepts of the other options in it. The answer is number 3, contact precautions. Use guidelines for delegating and assignment making. The nurse in charge of a long-term care facility is planning the client assignments for the day. Which client should be assigned to the assistive personnel? 1. A client on strict bed rest. 2. A client with dyspnea while receiving oxygen therapy. 3. A client scheduled for transfer to the hospital for surgery. 4. A client with a gastrostomy tube who requires tube feedings every 4 hours. Note the subject of the question, the assignment to be delegated to the assistive personnel. When asked questions about delegation, think about the role description and scope of practice of the employee and the needs of the client. A client with dyspnea who is receiving oxygen therapy, a client scheduled for transfer to the hospital for surgery, or a client with a gastrostomy tube who requires tube feedings every 4 hours has both physiological and psychosocial needs that require care by a licensed nurse. The assistive personnel has been trained to care for a client on bed rest. Remember to match the client's needs with the scope of practice of the healthcare provider. The answer is number 1, a client on strict bed rest. Our last slide is answering pharmacology questions. Quinapril hydrochloride is prescribed as adjunctive therapy in the treatment of heart failure. After administering the first dose, the nurse should monitor which item as the priority. 1. Weight. 2. Urine output. 3. Lung sounds. And 4 is blood pressure. This is blood pressure. Blood pressure. Focus on the name of the medication and note the strategic word priority. Priority. Recall that the medication names of most angiotensin converting enzyme, ACE inhibitors, end with pril. And that's Quinapril. It ends in pril. And one of the indications for use of these medications is hypertension. Excessive hypotension, first dose syncope, can occur in clients with heart failure or in clients who are severely sodium depleted or volume depleted. Although weight, urine output, and lung sounds would be monitored, monitoring the blood pressure is the priority. Remember to use pharmacology guidelines to assist in answering questions about medications and note the strategic words. The correct answer is number 4, blood pressure.